It's Sukin from China Press. I have 3 questions with me. The first question is, the Pasar Borong KL, we see there's 28 cases. So we'd like to know how many of them are foreign workers among them. Then the second question is, we are less than 1 week away from the end of phase 3 MCO, so we'd like to know KKM, on the KKM side, when will KKM advise the government whether or not to extend the MCO? And the third question is, because we see the new cluster detected in Pengerang, Johor, he was firstly suspected having dengue, which is the same, I think, in PY Bali, in Kuantan, one of the patients also firstly suspected as dengue. So is there any changes for those who treating suspected dengue patients, like for example, they have to wear PPE for those medical conditions?
Okay. Thank you very much for the 3 questions. The first is in Pasar Borong, we have screened more than 4,523 cases. To date, we have 28 cases positive, whereby 8 is warga negara Malaysia and 20 warga negara asing. So, and 1 death basically involving Myanmar citizen. So we will continue to, because we re-enhance the MCO in that area, we will continue to screen more of those targeted screening in the location as well as the high-risk group. So we hope that the next couple of days we'll identify more cases in that area. Second is with regards to the MCO. Yes, as I said yesterday, we already have 6 criteria to identify in terms of when we implement, or we continue the MCO or we really end the MCO, I do not know. But at least now we have the 6 criteria in place. That hopefully with these 6 criteria, this is a criteria given by the World Health Organization. But we need to customize the criteria. And once we have customized the criteria, and then we see how best we can fit into this criteria. The first criteria we're looking into is border control. And it is very important, border control. If we open up our border, then imported cases will increase. That's something that we learned from many countries that have done that. So we need to look into the issues of border control. In fact, we need to tighten the border rather than to ease the border. Second is that when we look into movement control, and we understand that movement control, that means the transmission, local transmission from one person to another has been decreased or reduced. So if that's the case, how can we maintain in terms of transmission to one person to another? Now, our tagline is stay at home. Once you stay at home, then we break the chain of virus transmission. Now, if you want to review back again, there are certain indicators we are looking into it. One is the positive infective cases. So today we have seen our positive infective cases is below 2,000 today. Yesterday was 2,045 cases. Today is 1,000. If you look into our cases, I just mentioned earlier just now, 1,987 cases. So this is positive cases, which means it's coming down. So we need to control these positive cases, whereby today we've identified the positive cases. Although asymptomatic, we will admit them in the hospital. Those mild symptoms also will admit them to the hospital. And we continue to monitor them. And we continue to treat them as well. Until they are negative, then only we allow them. So infectivity or positive cases that can transmit, can infect others, we need to basically isolate them. So we are doing the isolation. So you look into our total cumulative cases, minus the discharge and minus the death, and then that's where we have the positive infectivity cases that we have. So we need to make sure that we can bring down the cases. That's one. And then our daily cases now today, you see, is 2-digit 50 cases. So with the 50 cases, 5 cases, basically we are looking into imported cases. So the actual local transmission is 45 cases, although we have 50. But the actual, yesterday we reported cases, but there are actually imported cases as well as the local transmission. So the local transmission is important. That is the second criteria we're looking, and also the percentage. As I mentioned before, the infectivity 3.55 now is below 1. So we hope that we can bring down the cases now. Now it's 2-digit, probably in next 1 week or next 2 weeks, if we continue to enhance our MCO, we can bring down the cases, maybe a single digit. We have seen that in other countries as well, single digit. So these are the indicators for us to consider in terms of the MCO. Whether the MCO will live up or continue, we will advise the Prime Minister to make that decision in terms of advisory. So we get the data, everything, we show it to the Prime Minister, and it is a Prime Minister's decision whether to extend or even to have a soft exit strategy on that. So that's the second criteria. The third criteria is to enhance our healthcare facilities in terms of our labs. I mean, the turnaround time, although acceptable turnaround time is 24 to 48 hours, the guidelines given by WHO, we try our best to have the turnaround time less than 24 hours. And we have to enhance our capabilities of the hospital, our capacity and in the hospital to increase our COVID hospital, strengthen our ventilators, our ward, as well as our staff, for example. So these are very important. In any organization, the most important asset is our staff. So I think this is the third criteria. It comes under Ministry of Health. The fourth is that when we want to consider lifting up the MCO, we must protect the vulnerable group. For example, those elderly, and then those OKU, those who have comorbidities, and those who are undergoing treatment, for example, cancer treatment and etc. So we need to protect that. So we must have a mechanism to look into protecting the old folks' home, etc. So we are looking into that is a fourth. The fifth is that the new norms. This is where I think we have to discuss. When we start our life again, it's not going to be back to normal, but we need to adapt to the new norm, whereby one, there's no public gathering. Second is that social distancing. Third, protect ourselves in terms of if you are in the public, for example, and if you are facing a lot of people, then you have to put on your mask, encouraged to put on the mask. Hand washing, don't forget about hand washing. So every now and then you should use your sanitizer or hand washing. Keep your good hygiene and take all the precautionary measures. So that is important, and that transcends across all ministry, all departments, and all agencies. The first is we need to look back, as I said before, when WHO declared the public health emergency of international concern. There are three factors. One is the fatalities of the virus. Second, looking at infectivity of the virus, how fast the virus can spread. And third is the economic sector. They also look into the economic sector, whereby if you were to look back during the first wave, we protected the economic sector. That means whatever we do, we treated the 22 patients during the first wave, and then all of them discharged. You don't even feel, in terms of the disruption, the social disruption or economic disruption. So now we need to look into the priority. We have started the essential list in terms of the economic sector. And now maybe we have to open up the industry and etc. economic sector, but they have to follow the new norms that, for example, as I said, no social gathering, social distancing, and make sure that they comply, maintain the good personal hygiene. So all that we will put in place, and we will continue to adapt and to implement in terms of looking into targeted approach. If there is an outbreak, for example, in certain area, outbreak cases, then we will come in to look into the MCO, enhance the movement control in that region, and we screen everyone there. So it can apply to a department, it can apply to a factory, it can apply to a group of people. So that's the fifth criteria, meaning we adapt to the new norm. The sixth criteria, which is also very important, is the community empowerment. So we have to empower our community, whereby now we're back to the green zone, whether it's a state, whether it's a district, whether it's a mukim or a kampung. We have to empower the community. So we have to use the workforce in the community, for example, in the district level, to protect the green area. and to promote in terms of the new norms that we have. So all of us today, we practice new norm. For example, we do not shake hand anymore. So from a distance, we greet, the way we greet people, it already changed. And then we continue to have social distancing. We continue to maintain a high standards of hygiene, for example, and take all the precautionary measures. So these standards will be there, and it will be transcend across all ministry and departments. So these are the 5 criteria that we need to fulfill before we can even consider to end the MCO. The date 28th of April, but maybe 2 or 3 days of even 4 days before the end of 28, we will advise the Prime Minister based on our modelling, based on the facts and figures that we have, and based on the advisory from the WHO, and customize the advisory to our local needs. So that's how we're going to put up the framework. And the framework comes from the Ministry of Health, but to fill in the blanks, we need to empower the factory, the employer, for example, to follow the requirements that Ministry of Health has provided. In dengue, yes, we have actually informed most of our frontline workers to be careful, because not only dengue, even pneumonia, the SARI cases, those days SARI cases, you know, and they treat the patient, sometimes they do not protect themselves. So once they diagnose, for example, anyone coming to the clinic, once you are healthcare workers, you need to put on the mask, for example, take all the precautionary measures, and the diagnosis must be confirmed. And then the high index of suspicion now, because as I said earlier, the surveillance that we've done for ILI and as well as SARI, there are cases in our community. So we advise our frontliners, healthcare workers, to make sure that they protect themselves, because once you treat your patients, sometimes you are not protected. We already have a couple of doctors, for example, being infected from the GPs. I was told 45 of them have been diagnosed with COVID-19. So it's important for them, the GPs, the frontliners, those come to the GP's clinic for cough and cold, even for running nose, you have to protect yourself. So we are telling our doctors in treating SARI patients, all SARI patients will be considered as COVID positive until proven otherwise. Which means even though you do not have the results, you treat them as a COVID positive patient until you get your result, rather than you treat them without protection and then you get the result later on. So that circular has gone out, and we hope that all our frontliners take precaution in terms of treating those patients, even ILI or SARI.